Hi, I'm Christopher Archiopoli, and we're here for King County Recovery Conversations, a place to celebrate recovery and help break stigma of addiction and mental health. I'm one of the hosts for King County Recovery Conversations, and I'm here with my guest today, Jared Stern. Hey, Jared, how are you?
I'm great. Thanks for having me.
I'm super excited to have you.
Yeah, I love talking with you.
Yeah, it's my first time, and I couldn't be happier to have somebody that I feel really comfortable with, and one of my favorite humans.
Totally.
I think the most, I know you, I have known you for a couple years now. I've gotten the great opportunity to hear your story. And we talked a little bit about this beforehand. But I would love to have you introduce yourself to the audience, to the people listening, watching. I think that, a lot of times when we talk about recovery gets conflated with this idea of substance use. And more we're talking about it in the realm of behavioral health as well. But I'm really curious how you relate to that word and how recovery sort of fits into the story of who you are. So I will let you kind of tell us a little bit more.
Yeah, for sure. My name's Jared Stern. I use they, them pronouns for anybody who's listening. So I moved here from Australia for work. I'm an HIV researcher here at Fred Hutch Cancer Center. So I do HIV cure research, and I did my PhD in it back in Melbourne. And I guess I really kind of came to recovery through the HIV lens. Like, we're really seeing a really strong kind of syndemic of HIV and substance use disorder. And so a syndemic is like an interaction or an intersection of two epidemics. So the substance use disorder epidemic and mental health, as well as HIV. So I guess I came to it through that professionally. But of course, like, I myself am a queer person. I'm out and about. I'm certainly exposed to substance use as well. And I think I'm really grateful for my community and for my chosen family for really looking out for me and being quite candid about substance use, so that whilst I don't necessarily have lived experience about being in recovery, I am really grateful for people who've been able to share their stories about that.
Yeah, and I think, the way that I view recovery too is really, it's beyond substance use, it's beyond behavioral health. I think like chronic health conditions like HIV, certainly fit into that. I know that part of my story, receiving that diagnosis, incorporating that into part of my identity was certainly a recovery process. It was acknowledging that this huge part of my life had changed, and it required me to figure out who the new version of Christopher was from there. So I'm curious, like, how that process was for you, and how you incorporated and assimilated that information into your identity over time.
Yeah, I think it's a really good point that you raise in terms of coming to terms with these parts of our identity, and I think also kind of coming to terms with how society treats us as individuals with that particular identity, in the sense of like substance use and HIV and mental health. They're such like stigmatized topics in our societies. So I guess, maybe whilst I'm not necessarily in like recovery from substance use disorder, I'm kind of in recovery from like heteronormativity or just normativity in general, in the sense of, with HIV, I think the assumption, especially right now where we are in a much better place than we were at the beginning of the HIV epidemic, there's this assumption that you are HIV negative until proven otherwise. And now I'm constantly having to prove people otherwise, and having to kind of see in their eyes, like tackling kind of their own prejudices and their own biases that they may have about HIV and how people necessarily acquire HIV, and kind of grappling with all of that.
Mm-hmm. Yeah, I'm curious. I remember, when I received that diagnosis for myself in 2008, how traumatic that was. Part of it was the way that the news was delivered. Part of it was that I wasn't prepared for the news, and just how that would change my world. I'm curious, like, what your story was in how you received that news, like what the situation was, and how that kind of shifted your perspective on how you were going to live your life.
Yeah. So I was diagnosed when I was 19 years old. It was actually my second ever STI test that I had, was a positive test, and I knew that it was going to be positive. Like a sexual partner of mine had told me that he had tested positive quite recently. I was in the throes of seroconversion illness, so like I was very, very sick. It was probably the sickest that I've felt, in the sense of I had like the night sweats and the fevers and the shakes and all of those things that some people experience when they first acquire HIV. So I kind of knew what my result would be before I got the result. And I guess when I was younger, I grew up in a fairly kind of conservative, religious Jewish household, where queerness was not really accepted. It wasn't really talked about in my family or in my community. So um, I think I really kind of internalized a lot of that homophobia, and I didn't see myself particularly represented out in the wider society. So when I was a teenager, to be honest, I didn't really see a future for myself. Um, I was quite suicidal at the time, and I didn't think that I would be on this earth for very long. So then when I received my HIV diagnosis, I kind of like, there was this compounding of internalized stigmas. There was the internalized homophobia and the internalized HIV stigma of like, yeah, this is how I'm going to die now. And I kind of, in a way, saw it as confirmation that, yeah, I'm not long for this world. But in all of that being said, I was really grateful because my HIV diagnosis actually meant that I ended up being connected with my community. I was really grateful that my doctor at the time, I remember maybe 6 months after I was first diagnosed, and I was on medication, and I achieved an undetectable viral load pretty quickly, which I was quite lucky for. Um, I had a doctor's appointment, and my doctor asked me how I was doing, and I was like, "Look, honestly, my health is fine. I feel great. I'm one of the really lucky people that was diagnosed quite early, so I haven't really experienced any negative health side effects of HIV or of my medications either. But what I did find was I was feeling really lonely. I was feeling like I am the only HIV positive person I know. I've not met another person. So again, there was that compounding of not seeing myself represented as a queer person, and now also not seeing myself represented as a person living with HIV. And I'm really grateful that my doctor was quite connected with community, and she pretty much instantly texted somebody and was like, "Hey, I've got somebody who is wanting to get in touch with community. Can you meet with them?" And their name is Brent Allen. And I met with them maybe a week later. And honestly, they've just been like a real life force for me. They opened their home and their family to me with their husband, Paul Kidd, and they have like an amazing chosen family. A lot of people who are living with HIV. So whilst initially, yeah, my HIV diagnosis, I saw it as kind of confirmation of I'm not here for very long. I was actually then connected to the people that I needed to be connected with through my HIV diagnosis. And suddenly I saw myself represented in people. I saw a future for myself. I saw a way that I could be loved and I could love other people that really felt authentic to me and really genuine to me. So it was quite a really like quick switch, I would say, in my brain of forgetting all of those past kind of thought processes that I had internalized when I was a kid.
Yeah, I think that's a really interesting point that you make, and it resonates with me in feelings that I've felt over the years too. I remember thinking I wouldn't make it to 30. I remember thinking I wouldn't make it to 40. And, now I'm in my 40s, and, I really hope that I make it to 50. But, I think as queer people, we were sort of brought up with this idea that, we were going to die, something was going to get us, like the boogeyman. And for a lot of us, the boogeyman was HIV or AIDS. I'm curious, a lot has changed since the 80s and 90s. An HIV diagnosis no longer has the same implications, but, we have great medications for prevention as well as for treatment. What hasn't changed? What is still the same? Yeah.
It's a really good question. So I guess to first highlight what is different, because I think it's really important, is that, as you said, we do have prevention. We have pre-exposure prophylaxis. So it's a pill that people take every day, or now there's even long-acting injectables where somebody gets an injection once every couple of months. There's post-exposure prophylaxis. So if you're exposed to HIV, you can then take these pills for a month and prevent yourself from acquiring HIV. And then those same kind of medications are being used to treat people with HIV, like myself. And that means that if we're able to achieve an undetectable viral load, we can't transmit to any of our sexual partners in what is now known as U equals U, or untransmittable equals untransmissible. And I think those things have really allowed for us to kind of reclaim this bodily autonomy. Like, we are, whilst we might be living with HIV, we can still be in control of it, and it isn't affecting our lives as much. So I think for a lot of people who are able to achieve that undetectable viral load, HIV doesn't really affect our health all that much, at least on like a granular day-to-day scale. But what does really affect our lives is like the stigma and the discrimination that comes from it. I think there's still a lot of fear in the wider community about HIV. And I think also because we have these tools in our toolbox to prevent HIV acquisition, as well as to prevent people from getting sick if they do acquire HIV, there's kind of this expectation of like, you should just be happy with what it is, and you should just kind of almost just allow that part of your identity to become invisible, because, you know, HIV is not a problem anymore. And yeah, I know we've spoken about it a lot in length outside of this podcast, and I've got a lot of mixed feelings about that, because in some ways it's really nice not to have to think about HIV every single day. But in some ways, I feel a little bit remiss that some of that identity is being just masked and being made invisible. And it further makes it more difficult for people to connect, because we may never know that we both people with HIV in the same room if we don't talk about it. So we're kind of like two ships in the night almost.
Yeah, I mean, that is certainly something we've talked about a lot. I mean, that's how we met. Just for context for everybody else, I facilitate a support group called Positive People. We meet Monday nights from 6 to 7 at Pure Seattle, and that's where you and I met. And I think part of what bonded us was this recognition that a shared need of community, shared desire to build something for people living with HIV, because it really isn't around as much anymore. I mean, part of that is a function of COVID, and a lot of in-person stuff has kind of gone away. But also, you and I have talked about how we've sort of been, placated by pharmaceutical companies. We have these effective medications, so we don't need to be as loud as we used to be. With that being the case, like, what is the importance of building community in your mind still?
I think it's really to tackle that stigma and to tackle that discrimination. Like, even though I'm a queer person, and the queer community is generally much more well aware about HIV and all of the tools that we've got to prevent it and to treat it, I've still received a lot of stigmatizing things from my community, in the sense of, I've had previous partners like break up with me because of my HIV status, or make jokes about me being dirty or me being unclean. And without community, without other people who are living with HIV for me to turn to, I can very easily just take those things as gospel, take those things as truth, and be like, oh, well, I am a dirty and I am an unclean person. So being able to have somebody else who has the same lived experience as you can really help challenge that that dogma when it is so pervasive, when it is kind of the majority kind of viewpoint of the world.
Yeah, that word "dirty" is really hard to see. I mean, it's something that we see in profiles for dating and for hookups, and people are referring to us as dirty, and that's a very dehumanizing word, and it's something that I discourage people from using for sure, whether it comes to HIV status as well as substance use. A lot of times, people who are in sobriety are referred to as clean,
Yeah.
which has an implication that if you're not, you're dirty. And, I really try to discourage that.
Yeah, it's funny how that word clean is used in the substance use world and in the HIV world. And yeah, it's kind of ridiculous.
Yeah, I agree. What are some of the things that you're working on right now to encourage, building community and to get people together and to kind of work against this disconnection that we've experienced over the last decade or so?
Yeah, I think I really just want to encourage this self-autonomy for people with HIV. I really want to encourage this like self-confidence of you are your own autonomous person. You exist outside of the virus that's living within you, and you exist outside of the society that you're living within in some ways. Like you can determine what your life wants to be. And certainly there are a lot of structural barriers in place for people to have self-determination. So I think a lot of that is me trying to bring down those structural barriers, but also trying to empower the community, particularly through like the knowledge about their bodies. I'm really passionate about kind of scientific communication. I think even though I am an academic, academia is kind of put on a bit of a pedestal that's just not reachable for people, and it makes it difficult for people to actually gain knowledge about their own bodies, even though they may be contributing to this research through their own bodies, through their own blood and tissues that they're supplying to these trials. So it's a lot about educating the wider world just about like what HIV does to our body and things like that, but also educating the academic world about how HIV affects people on a day-to-day basis. Because I think sometimes in my experience, researchers and clinicians can kind of compartmentalize it, and they just see it as part of their work. They just see HIV in the lab, and they don't really see it existing outside of the lab.
Yeah, and I know that I've personally experienced, stigma in medical situations from, physicians who maybe didn't have enough knowledge, when I was in the emergency room or, with somebody who was outside of like the specialty of working with HIV. Have you ever experienced, that type of stigma in a medical setting?
Oh, totally. Yeah. Even within the settings where people should be better educated about it. I remember back in Australia, I went to a sexual health center. I needed to get treated for bacterial gonorrhea infection. And there were, a spate of a few months where I had to go in quite a few times because I was just having fun in the summer, I guess.
Good for you.
Yeah. And the nurse that was administering the shot in my butt afterwards said to me, now I don't want to see you here again, okay? And they were very successful with that. They didn't see me there again, but that didn't stop me from getting gonorrhea again. I just went somewhere else to get treated instead. So, I think people don't really address what their implicit biases are a lot of the time in the medical world because they're not really exposed to people living with HIV outside of like the doctor-patient world. And I think that even exists in my research where oftentimes papers will refer to people as patients or as subjects or as cases. And it's like, to you, that's what we are. But to us, we're people. We exist outside of these trials that you're making us participate in. And there needs to be an acknowledgement about that.
Yeah, I agree. What do you think can be done? I mean, are there ways that you think that we can address that? Are there things that you're aware of being done? I know that I've seen some stuff myself, but I also know that I've left doctors' offices crying. So curious what your thoughts are on that.
Yeah, I think there are some kind of small incremental steps being done in the sense of there are larger kind of peak bodies trying to make terminology changes and trying to make those as guidelines. I would really like those to not be guidelines anymore and be requirements. Like you're not going to get your paper published in our journal if you use the word patient or if you use the word HIV infected for somebody instead of people living with HIV, for instance. But I think that is kind of a bit of a a band-aid on the wound, in the sense that it doesn't really address the main issue, which the main issue is that there's not really representation of the voices of people with HIV in these peak bodies, in these kind of, higher level discussions. So really what I would like to see is just much more representation. I would like to see people living with HIV on review boards, in doctors' offices, being doctors themselves, being nurses themselves, being politicians. Like, I joke about all the time. There's this famous poem that is, I want a dyke for president. I want a person with AIDS for president. And that's what I want.
Yeah, I think, well, and that hits on, the value of peers. It hits on the value of having connection with people that have similarities, and seeing yourself represented. I think that there's power to that. There's also, we've talked a little bit about shame and stigma and how that's related to negative experiences that you've had. And I certainly see that as well. How can we bring all that together? How can we take the shame and stigma, acknowledge that power, and then also uplift peers into places that are hard to access? Like you acknowledged, academia is hard to access. There's a lot of barriers, not the least of which is, time and money.
Yeah, it's a toughie. I think my main thing that I would like to see in addressing stigma and discrimination about HIV is that it's often the impetus and the onus of combating that stigma is on the people living with HIV. And that occurs for like any kind of oppressed identity, really, whether it be race or sex or gender identity or sexuality. It's often on the people who are being pushed down that are the ones that are having to like hold these people's hands and walk them through it and try to educate them why it's not nice and not good to be doing those things. And I would really like to reverse that dynamic, and I would like people to reflect more about how are they treating people, how what have they internalized that is no longer serving them and is causing harm to the people that they care about.
Yeah. Let's turn to, kind of what you're doing. So, when did your passion for science develop? And we've talked a lot about sort of your community involvement, but, a lot of what you do does happen in that sort of like research realm. Where did this all start for you?
I was a really nerdy kid when I was growing up. I really loved science. I was also kind of the weird kid growing up. So I was really, into like sci-fi and horror. So I really loved like the books of like Michael Crichton and like Sarah Langan, who wrote these really cool like biology, science, body horror books. I was like 10 years old reading these books kind of thing. So I just found it really fascinating how these tiny little microscopic pieces of machinery, which are like neither dead nor alive, could instill such fear in our society and instill such like visceral reactions to us that we make such a genre of media about them. And I think as I started getting older, like it wasn't just this kind of scientific interest of it, but it was this sociologic interest of like, how do these viruses actually reflect our own relationships within society? And so as I started getting a bit older and into my teens and my latent homosexuality became less and less latent, I started really latching onto the movement of ACT UP, who were kind of the peak community body that was responding to the AIDS epidemic in the 80s. And I think they did kind of what I said just before about like reversing this dynamic of trying to placate the masses and trying to convince the masses that we are acceptable. I think it's not about acceptability. It's just about us being humans. So yeah, I think viruses are just a really neat piece of biology. And I think we don't realize how we ascribe a lot of our own like societal issues onto these viruses, which frankly don't care about these things. You know, like HIV doesn't care about racism. HIV doesn't care about classism, but it cares in the sense that these issues allow for some people to be more vulnerable than others.
Yeah, absolutely. I mean, because on a very fundamental level, you're right. Viruses don't discriminate, but unfortunately, humans do. So, I mean, we could talk about this for hours, but how, in your opinion, do different identities, particularly marginalized identities, end up disproportionately impacted by HIV and things like other STIs?
I think the main drivers are really racism when it comes to HIV. The fact that HIV was the response to HIV was so much slower compared to like COVID, for instance, where we knew that there was a new virus that broke out maybe a month after it actually started, and we knew what the virus was a few weeks after that. The timescale for HIV was so much longer than that. For instance, like AIDS was only recognized in the early 80s. We didn't find the virus until 1984. So there was almost 3 years where we didn't even know what was causing AIDS. And again, because there was no representation of queer people or people of color within the medical community, there was just the most like ridiculous, absurd hypotheses that you've ever heard. Like people thought that it was poppers causing AIDS or that it was fisting that was causing AIDS. It was just anything under the sun that was different to them. They thought that's what it was causing. And I think that perpetuated this idea of like the dirtiness and the uncleanness of people with HIV. But yeah, so there was that extended time for us to discover the virus, but even discovering AIDS as an issue was 1980s was when we started reporting these cases. But studies have shown that HIV probably entered the US as early as the 60s. So it went decades being unnoticed in the US. And it went even back further than that. There's studies that are suggesting that HIV emerged in Kinshasa as early as the 1920s or the 1930s. And again, Africa, because of racism, there's just not as good of a medical infrastructure there. There isn't as much of a priority for people of color within that geographic region. So their issues just weren't being addressed. Their deaths weren't being addressed by the wider world until it started affecting white, gay, cis men. And again, even though it was queer people and they were still oppressed, they still held some levels of privilege. They still were cis white men.
Yeah. So we've talked about, treatment. We've talked about prevention. What is happening in terms of a cure? What's the work being done? And I think we talked a little bit about your interest in that.
Yeah. So I guess my desire and like my desire to pursue a career in researching an HIV cure rather than HIV treatment or HIV prevention is the idea that even though we have such good treatments and we have such good preventions and we have all of the tools in our toolbox, so combining PrEP, combining treatment, combining condoms, which are still useful for people, and regular HIV testing, these 4 things combined can mean that we can entirely end HIV transmissions today if everybody who was vulnerable was accessing the things that they needed to access. But that doesn't mean, like, ending HIV transmissions does not mean that suddenly 37 million people living with HIV around the world are just going to disappear that day. Like, we are still going to be here. We're still going to be living with HIV. And although HIV doesn't have effects on really a day-to-day basis, we do still experience effects with HIV. We do still experience what we call ongoing immune exhaustion and ongoing inflammation. So it's this kind of like inflammaging that we say, and HIV is almost a disease of increased and rapid aging now. So we still have ongoing medical needs that need to be addressed, and that needs to be addressed with a cure. So yeah, that's kind of why I wanted to get into HIV cure research. What is happening with HIV cure research? So far, about 6 people have been cured of HIV, which is really great. The first person was Timothy Ray Brown, and that was over a decade now, and he's since passed, unfortunately. And he was a really great kind of beacon of hope for us that maybe it's possible, but it was kind of just a one shot, once off person. And now that we've got 6 people that have been cured of HIV, we know that it is possible, and we know that it is reproducible, which is really important in science. But the way that people are cured of HIV right now is that they have to undergo full body irradiation to completely kill off their entire immune system. And then they need to have that immune system reconstituted with an immune system from somebody who is immune to HIV, because they have a specific gene deletion in one of their genes called CCR5. And that's just not practical, in the sense of it's very expensive, and frankly, it's very risky. Like, it carries a high mortality rate. And if you're able to just live with HIV and take your meds every day and not really be affected with your health, you don't want to risk dying because of this cure. So now we're just trying to find a scalable cure for everybody. How can we kind of replicate this without all of these side effects? And how can we make sure that everybody who is in need of a cure can get that cure? And I think for me, a real priority is also making sure that that cure is accessible. Like, we have incredible treatments now, but we don't have everybody who's on treatment, because treatments are ridiculously expensive, or you have to jump through a bunch of loopholes in order to be able to get it. And I want to make sure that we're planning for when we do have that eventual cure, that we can just give it to everybody who needs it.
So I'm going to thank you first for sharing your story. But I do want to close with kind of a two-pronged question. One, what do you wish people knew about HIV that, who are not people living with HIV? And then, kind of dovetailing off of the idea of the importance of sharing stories, I'd love if you would just give a shout out to the AIDS Memorial Pathway, because I know that you do some work with that. And I think that it is such an important resource in our community that people don't know about, that is about sharing people's stories. So if you wouldn't mind touching on those two things.
Yeah, I love the shout out for the AIDS Memorial Pathway. When I first moved here to Seattle, I was like feeling very much like I was missing my chosen family, my HIV positive family back in Melbourne. And I was sitting in Cal Anderson just eating some sushi, and then suddenly I saw the words "silence equals death," and I knew that was a harkening back to the ACT UP movement. And I started exploring around the AIDS Memorial Pathway, and I did realize that what it was. I realized it was the AIDS Memorial Pathway, and I think that's kind of like eventually how I got connected with you as well. So it's that was a really nice pathway, literally pathway of representation of people with HIV in the forefront, very visibly, very publicly, and then connection to community. I think those two things are super, super important. And in terms of like what people don't know about HIV, I think in the AIDS Memorial Pathway, there is an artwork called "We're Already Here," talking about people back in the 80s with HIV, and everybody worried about them being in our communities. And there was a person's response saying, "We're already here." And I think my continuation of that is, we're still here. Like, even though HIV isn't as big of a problem as it was back in the day, we're still here, and we still do need things, and we still need our community. And I would like people to not be ostracized from their community just because they receive an HIV diagnosis.
Yeah. We all deserve connection.
Absolutely.
Well, thank you, Jared, for hanging out with me for a little bit today. Even though I knew a lot of the stuff we talked about, I always learned something new, and I'm just so grateful to have you in my life. So thank you, everybody, for listening and watching King County Recovery Conversations. Thank you, Orbit Audio, and thank you, King County Behavioral Health and Recovery Division.
And thank you, Christopher.
Take care.